got sores breaking out all over me. I mean, I don't know what's causing them. I mean, I was told last night because I popped something. I ride a bike, so I popped something when I did. It just.
And that happens often, or?
Yes, ma'am.
I am willing to say there are two things in this life we'd never ever want to lose: our health and our hope. Think about that for a second. And yet there are so many times in life when that is exactly what happens. And none of us are immune either. Take Freeman Scott, for example. He's worked his entire life, and he had a good-paying job, too. Ironically, he also worked in the healthcare field until one day he didn't. No longer with a job or healthcare, he also lost his hope.
I found myself in a position in my late 50s, just about to turn 60, of being aged out. And I couldn't get back to work. I had a significant savings. It didn't take very long to go through it because obviously you're living at the same level that you were living when you got laid off. And consequently, when you lose your employment, you lose health care because health care is tied to employment and so forth. And I wasn't at the age of 65, so I wasn't able to get Medicare. I had two chronic conditions, hypertension and diabetes. And I was told that there was a service in the community, and if they accepted you, they would take care of your health care needs and they could get you medication. And sometimes they did it at a very, very low cost. So I ended up finding the Health and Hope Clinic. Once I came in, they gave me, first of all, they took a financial application and medical history and so forth, and they started to give me the drugs that I needed for my chronic condition. During that process, I contracted MRSA and pneumonia, which I didn't even know I had. One day I was fine, next day I wasn't. Following a couple of days, I was in the hospital flat on my back, needing surgery and so forth. Once I was there, they discovered a mass on my left kidney. So in addition to the other problems that I was having, which were exacerbated by my chronic conditions, they found this mass. When I came back here after discharge, they determined that in order to figure out what the mass was, I needed an MRI. So they worked with Baptist and they got me an MRI. The first illness actually saved my life because once Health and Hope did sponsor the MRI and we got the result back, it turns out I had a 5-centimeter tumor in my left kidney. And it was very close to getting into the lymph node. And we were able to remove the mass, and they put me in immunotherapy. I was in immunotherapy for over a year. And since that time, I've been cancer-free. I'm going, I think it's my 3rd year in March when I go for my next scan. Hopefully it will come up clean and we'll be okay.
There is no doubt in Freeman's mind that if he had not found the Health and Hope Clinic in Pensacola, he would have also lost his life.
I can tell you without a doubt, I wouldn't be sitting here had I not been able to get that health care through this clinic. This clinic saved my life.
And his story is not as uncommon as you might think.
I needed to have a hysterectomy. I had something on one of my ovaries and they could not biopsy it. So we opted to go ahead and do the complete hysterectomy. And when they went in for the surgery, it did not end up being cancerous, but It had done everything except begin to replicate cells. So the quick thinking here of the staff that got me the care I needed through Sacred Heart blessed me to have that surgery that I believe God intended for it to be right then before it replicated, because that was the next step and it would have been cancer. When people would ask, where do you go to the doctor? I would say, well, we just pray that we don't catch anything that the drugstore can't cure. And the drugstore could not have helped me with that. So Health and Hope was definitely has a place in our heart. And we minister to the homeless at our church. And so we're always telling people about Health and Hope and how they can come here, and they're not a number, it's not a clinic, it's a place where you're loved and cared for.
The intention was to start a dental clinic in the beginning, but due to the high cost, organizers quickly figured out that it would take a full-on clinic with multiple healthcare services to support this challenging endeavor. Because of their connections with all 3 major hospitals, no ailment is beyond their scope, including mental health issues.
Well, let me just say the thing that I love the most about this clinic is that it does take a truly holistic approach to the entire person, not just physically, but mentally, emotionally, and spiritually too. And oftentimes that piece gets overlooked, not considered, so that we all talk about integrated care and holistic treatment, but very few agencies or programs actually do that. I don't know another facility that has that. When somebody has a lot of anxiety, their chest is beating, their heart is racing, they're sweating. But that's what happens when we're in a fear response. So it doesn't necessarily mean that maybe there's a cardiac issue, but it's a mental and emotional issue. So the body is very much connected to how we feel and what we think. And if you can take care of both simultaneously, it's a much more powerful impact. And knowing the difference between is this a mental health occurrence or is this a physical health occurrence is really important too. And because we have 2 services here that provide both that aspect and the mental health, the physical aspect and the mental health aspect, we can address the whole system.
Which brings us to the Jesus connection. Yes, this is also a spiritual place.
I'll ask them. We're very respectful of our patients. If they say I'm good, we leave them alone. But anyways, I'll say, can I talk to you about that? And a lot of times they'll say, yeah. And I'll explain the gospel to them. And our prime goal is to introduce them to Jesus Christ and tell them that there is hope. You can have hope, and that even though life can be tanking around you, if you got Jesus Christ as your Lord and Savior, you got hope in your heart, and that gives you a reason to live right there.
They're called encouragers, and they sit in the waiting room among the patients, ready to pray with them.
I just want you to understand a couple things. We are a Christian faith-based organization. When you come in here, it's very rare for me not to have an encourager here. And in most cases, unless they're super busy or something, that encourager is going to approach you and they're going to ask you, how you doing and how can I pray for you, and give you their name. And I said, all you got to do is say, I'm good, and they'll leave you alone. We've trained them that way. They know that. And I said, and I'll just tell them when I walk away, I'll say, look, I just want you to understand, you don't have to go to church. You don't even have to believe in God. And we're going to take care of you as one of our patients. And that's just, that's the main part. I want you to know that you are going to get approached here. I would say the receptiveness is 99% favorable. I have had in 6 years very, very few, limited number, one hand of where I got basically a hand put in my face and said, I'm not interested.
And that's one thing, I'm definitely a firm believer, it's okay to have Jesus and a therapist. You have to have both, even if it's a higher power, whichever way people believe. regardless if it's religion, but I tell people it's relationship. So the thing is, being able to have that relationship with Christ, and also whichever way they believe, their belief system, it gives them a solid foundation to build upon. Because just as well as your spiritual journey is a choice, your mental health journey is a choice. Anything that you do in life, whatever you put into it is what you're going to get out of it. So it's definitely a choice every day to walk with the Lord, and also walk with Him on this journey to become a whole person. That's all it is. Everybody's broken, but we become whole. So building that relationship is what keeps this whole situation with health and hope, with mental health, with spiritual health, physical health, everything to be the way it is. It's starting with Christ for me, always.
It's like the Lord's hand. He just fills the gap with health and hope. Because seriously, if I were to, and I've worked in the private sector, I've worked in areas where you had to get insurance. I've worked as a teacher for 3 years. And, a lot of the time that you work, you're working for your health insurance, right? So it's a wonderful testimony to the Lord that He's moving through people who want to give, who see these people who are in that predicament that according to mankind or whatever they say, you don't fit. Because according to them, we don't make enough money to make or get insurance or any of those things. So we do kind of fall through the crack. But the Lord said, no, we'll just fill that crack with health and hope.
Meet Sally, the backbone of this place. As the executive director, she is also her own secretary, grant writer, public relations firm, fundraiser, and the face that hundreds of volunteers and patients know as the reason the Health and Hope Clinic is saving lives. But Sally believes it is no one other than God Himself who keeps this place afloat.
It has never happened where I'm not stopped by a patient. And I don't even know how they know that I'm the executive director, but they do. And they stop me and tell me their stories. And that's how I know that we're making a huge difference. And He is ultimately in charge. When I start getting a little anxiety about a panoramic x-ray machine that's about to break, that's $80,000, this is a true story. And this was in my second year here. The day it quit working, a dentist randomly picked up the phone and called and asked to speak to me because he was upgrading his machine and he was going to give me his Mercedes for free. And it happened to be on our same street. I mean, I don't write this down. I can't make it up. And when I start getting stressed out because something's about to break down, we just had something break down in our dental again. Dental's the most expensive thing we do here. I just say, God, You're in control. Here's all the grants I just applied for this month. Make one of them happen. And He just takes care of us. It's pretty amazing. But every dime that we get locally means more to me than anything, because it means that people are watching and they see what we're doing. It's pretty amazing.
This clinic is run by over 400 volunteers. And when somebody volunteers, that says, I'm not here for the money. I'm not here for the notoriety, the fame. I'm not trying to draw research and get statistics and data so I can be published, but it's saying that I really have a heart to help people and to heal people and to help them when they are struggling. And I think that is how this place, that's the heartbeat of this place.
We're all humans. We all share the same basic needs, right? And so in order to really help people, I feel like we needed to offer the whole package and be a one-stop shop as much as possible. Now, I'm not implying at all I could not do this job here. We could not do what we do at this health clinic without the support of the big 3 hospital entities and our big FQHC here, which is Community Health Northwest Florida. I mean, so it takes a village, but I love getting to brag out in the community. I'm not in competition with anybody because I don't take money for what we do. What we are doing is in our wheelhouse. We are right where we're supposed to be. People that don't have health care, they don't have Medicare, Medicaid, they're falling through the cracks, and that's where we really kind of step up, and that's where I think our role is with the community. But the more I can get in one-stop shop, even specialists, so our new big, our new secret sauce is having all these specialists that come in and they're seeing the patients here, and they're doing the vetting if they need something more complicated like a surgery. Specialist that already works at Baptist or Sacred Heart or West Florida, and they're saying, yeah, this guy needs a life-saving surgery. We got to help him do this. They're all getting approved now because we are really taking it to heart that we don't want to waste the big hospital's money. We're trying to keep them out of the ER.
I need some antibiotics and my medicine refilled if I can. Yeah.
Tell me about the antibiotics.
I got sores breaking out all over.
And many times people will think for our clinic that we're servicing those that may not work, but we do serve the individuals who work every single day, but unfortunately they can't afford health care.
And the working poor, a lot of them, they work just enough hours and that they don't get insurance and they fall through the cracks. And that is a lot of the people that we see here that are just really, it's just such a needed thing. And I think there's a lot more out there that we haven't even reached yet.
It's $2,400 a month out of pocket for myself, and then it would be another $2,400 a month for my husband to be able, and I'm like, we don't have $2,400 a month to be able to do that. I mean, that's every single month. And I'm just like, I can't.
They do take care of her really good when she needs it.
No, I mean, medication costs are ridiculous. They're insane. Some of them not too bad, but we have bulk programs that give us brand name medications, and I mean, those will never be cheap. Especially the insulins or the GLPs we have in there, it's crazy. And so, I mean, some of these patients are uncontrolled diabetics who desperately need insulin, and they have no way to afford it. And so it's extremely rewarding, not even in a way that they're saying, thank you to me personally, but it's rewarding to be able to know that they have a way to control their sugar, take control of their health. We're able to provide them that pathway, basically.
I know what we're doing is changing this community every single day. A lot of people are working, but let's say they work for a small business. They work for a restaurant downtown, and they're waiting tables. So that small business can't afford to pay for their insurance, and so they're working, but do they have enough to buy a $1,000 a month insurance policy? No, they do not. And so we fill in the gaps there for folks. So it's not like it's just people who are not working or doing anything. They're working and doing their part, but medicine's very expensive these days.
Every day is rich with an opportunity to touch a life. And what better way to advance God's kingdom work than to take our own personal circumstances? It's our skills, talent, God-given talent, it's our financial wherewithal, it's our careers, and we use that and dedicate that to touching the lives of individuals. And then because of that touch, we leave them better for it. And Health and Hope Clinic absolutely does that on a daily basis. And it's done with the staff. You can get so busy, you put your helmet on, put your head down, and you plow through the day, and you forget to look up. And if you don't look up, if you're not deliberate, you're going to miss the opportunity to see a need and then be able to step up and help with that need. And this is a staff with this organization that looks up all the time. And they never get so busy they lose their passion. Thank goodness they never get so busy they lose their compassion.
We have this mission. There's not much going on in the world right now where everybody is dedicated to a mission, professionally, socially, spiritually, that we can provide a service that no one else can provide. I've always joked that I'm better than no one. Well, these patients have no one else. So I'm better than that. I'm better than no one. So that gets me here on my bad days, and I'm always blessed when I'm here.
I think the main thing is a lot of these people, they just want you to listen. They just want to be heard. It is easy to dismiss them, and it's easy to say, oh, let's give you this medication and make you feel better. When they come to the class, we're going to do this workout, and then we're going to leave. But while they're working out, wow, you're doing great. This is amazing. You're actually doing more than you did last week. Let's try this, more heavier weight or whatever it is. And even those minor things of recognizing you did this much last week, you're doing better, and recognizing growth and just getting to know them and listening to them, it makes a huge difference.
Us being here
could potentially have just saved her life. And I hope it does. You know, we don't know what the outcome is going to be, but the fact that we were here made all the difference in this woman's life. And that's how our patients make the difference in our life.
We pour a lot of time and energy into ensuring that we are going to be good stewards with whatever time or money, whatever you're going to give us, we're going to do our very, very best with it, and it's successful. And so we've been very, very blessed and very fortunate to be able to sustain these things year after year and grow. We've not had to turn away patients because of finances, because of not having the staff. It just continues to speak for itself. It's awesome.
I think most of them you would find that people say, the clinic saved my life. Thank you for saving my life. Thank you for helping me through a really hard time in my life.
And I wish I could do more. And hopefully this interview will inspire some people to give, to support, either money, time, it doesn't matter, to help this facility and others like it flourish, because we need it, we really do.
This setting helps you provide more comprehensive care, which it's more rewarding when you can take a patient and try and restore their health so that they can get a job or recover from addiction problems that they've had in the past. Or some of the patients even have been abused, or some are immigrants and they're trying to get their foothold here in this country. And so, it takes wanting to serve, and help other people. Making sure that we can help a person to hopefully turn their life around, or to be able to go out in public and smile like they haven't been able to do for a number of years because this tooth had a big hole in it in the front or something like that. Sometimes it's the simple things.
And sometimes it's just having hope.
If this was not here, I don't even want to know. I think this clinic has just such a huge impact. We probably would just see more and more people on the streets, or just I feel like maybe the average person, they don't really encounter this type of niche problem, if that makes sense. And so I don't even want to think about the idea of this didn't exist, because it just gives so much. He mentioned, I think Jack mentioned the patient assistance program. When I first started inventorying it, he told me about there was this one med, it was 10 grand, but this patient's getting it for free. And I just think that's huge. That's huge, yeah.
Help keep health and hope alive, will you?